Hello everyone, welcome or welcome back to the channel, that is AMS MBBS lectures. In today's session, we're going to discuss another topic from CVS Microbiology, and that is your Ehrlichiosis, guys. Again, now this topic is a part of the family Anaplasmataceae, guys. Okay, we have the order called as Rickettsiales, which is having two family, that is Rickettsiaceae, and we have Anaplasmataceae, guys. Okay, see, if you haven't watched the first video with respect to rickettsia named as your rickettsial infections, okay, do watch that because I have covered a lot of information under with respect to rickettsia in that video. A detailed classification, the laboratory diagnosis, wheel Felix test, pathogenesis, everything has been covered. Right now we're just going to have a look on the second family, that is your Anaplasmataceae, which involves, okay, some genus like Ehrlichia, Wolbachia, Anaplasma, Neuricketsia, of which, okay, not every organism, okay, not every genus is pathogenic. Only a few species, okay, are pathogenic. So in Ehrlichia, we have species like Ehrlichia chaffeensis and we have Ehrlichia ewingii, guys, okay? Whereas in Anaplasma, we have Anaplasma phagocytophilum, and in Neuricketsia, we have Neuricketsia sinetsu, to remember, guys, okay? Now when I say Ehrlichia, guys, Ehrlichia ke andar we have Ehrlichia chaffeensis. Okay, this chaffeensis is going to infect the mononuclear phagocytes को infect करेगा, ठीक है, and the vector involved is tick, and it causes the disorder called as your human monocytic Ehrlichiosis. Clear? Similarly, the another species under the genus Ehrlichia is the Ehrlichia ewingii, and which is going to infect the neutrophils को infect करेगा, and it is again the vector over here is tick, and it results into something called as the human granulocytic Ehrlichiosis. Simple है, अगर mononuclear phagocyte को infect करेगा तो monocytic Ehrlichiosis होगा, and neutrophils को infect करेगा तो it will cause the human granulocytic Ehrlichiosis, guys. Clear? Then we have under Anaplasma, under the genus Anaplasma, we have Anaplasma phagocytophilum. This Anaplasma phagocytophilum is again going to infect the neutrophils. Okay, the vector is tick, and it is going to result into the human granulocytic anaplasmosis, guys. Okay, something very similar to Ehrlichia ewingii. Okay, something very similar to your Ehrlichia ewingii. Okay, but the difference is it will cause anaplasmosis, and here it is going to result into Ehrlichiosis, guys. Okay, both of the organisms alag hai, ye wala aur ye wala, both of the organisms are different. Okay, but what is the difference? Like, matlab tick ही है दोनों का vector, both are going to infect the neutrophils, but species are different. Okay, the genus is different, and it will result into two separate disorders, guys. Clear? The last category, that is called as Neuricketsia, which involves a species called as Neuricketsia sinetsu, and this species is affecting, or basically it infects the lymphocytes, and please remember it is transmitted by the ingestion of the fishes which are having or containing the contaminated flukes. Okay, contaminated flukes, and it will cause something. Lymphocyte को affect करेगा तो human lymphocytic Ehrlichiosis is what it is going to cause, guys. Clear? So this slide, okay, sum ups a lot of information, okay, with respect to the various genus involved under the family Anaplasmataceae, the different species involved, the disorders which okay they are causing, which particular cell they are infecting, and what is the vector, guys. Clear? A lot of information is, okay, given in this particular classification only. Next thing, that is Ehrlichiosis ka epidemiology. If you have a look, this, okay, the incidence of Ehrlichiosis is very much prevalent in USA, the United States of America. USA में बहुत ज़्यादा prevalent है, except the Neuricketsia sinetsu. Okay, this thing is very much common in Japan, guys. Okay, the incidence of Neuricketsia sinetsu causing human lymphocytic Ehrlichiosis is very much high in Japan, guys. Okay, then this Ehrlichiosis has some animal reservoirs like your white-tailed deer and dogs, guys. Okay, these are the animal reservoirs for Ehrlichiosis. Clinically देखा जाए तो they will produce, this particular condition is an acute febrile condition, guys. Okay, it's an acute febrile disease which is characterized by some, okay, very common symptoms जैसे कि headache, muscle pain called as myalgia, joint pain, that is arthalgia, cough हो सकता है. There can be inflammation of the pharynx, okay, that is your pharyngitis. Okay, your lymph nodes can get involved, that is your lymphadenopathy. Some GIT symptoms like your diarrhea, nausea, vomiting, abdominal pain, and also there would be some CNS changes, that is your changes in the mental status. Okay, so these are the various clinical features seen in case of Ehrlichiosis, guys. Okay, Lastly, please remember that is if you are discussing Ehrlichiosis, you have to talk about inclusions. Matlab, whenever these organisms enter into the body, they are going to reside into something called as the phagosomes. Okay, and inside the phagosome, they are going to multiply to produce the following three stages of the growth. That is, the first stage is called as the elementary body. Second stage is the initial body, and then it will get converted to those mulberry like inclusions called as the morula, guys. ठीक है, mulberry like ऐसे, morula मतलब mulberry like inclusions. Okay, so काफी काफी छोटे 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 multiple mulberry like inclusions में convert होगा, guys. ठीक है, and this morula, guys, okay, they are present within the neutrophils and they are detected in nearly 20 to 75% cases के अंदर you can detect a morula in the neutrophil. Okay, nearly 20 to 75% केसेस बाय डूइंग अ जिम्सा स्टेन. देखो न्यूट्रोफिल्स की बात कर रहे हो है ना, तो मतलब वी हैव टू प्रिपेयर अ ब्लड स्मीयर, अ पेरिफेरल ब्लड स्मीयर, एंड वी आर गोइंग टू स्टेन दैट पेरिफेरल ब्लड स्मीयर विद द जिम्सा स्टेन. तो कैन आई से अ जिम्सा स्टेन्ड peripheral blood smear is what is required, guys. Okay, peripheral blood smear is required. Stain it with the Giemsa stains and then observe it. You can appreciate the morula present within the neutrophils, guys. Okay, and again they are seen in nearly 20 to 75% of the cases. What is the treatment for Ehrlichiosis? Okay, what would be the treatment? Again, it would be that is your doxycycline. Okay, so we can give doxycycline can be given. So that was all with respect to Ehrlichiosis, guys. We are done with Ehrlichiosis. That is it for this session. If you found this content useful, then do like, share and subscribe to the channel. If you have any questions or queries, do comment down and then to answer it. See you on the next one. Bye bye.